I'm going to send things over now to our first speaker, Dr. Timothy Ainger. He is a clinical neuropsychologist and assistant professor of neurology with the UK College of Medicine and the Kentucky Neuroscience Institute in Lexington. He focuses on applied neuropsychology and examining ways to enhance the clinical conceptualization of diverse populations and diagnoses. Resiliency and wellness is one of his many focuses for his clinical work and research. Welcome, Dr. Ainger.
Good evening, everyone. I hope you can hear me okay. I think I figured out how to unmute myself properly, and I apologize for the contrast, but the sun is setting here in this part of Kentucky. I'd like to talk a little bit about toxic stress, and I want to be able to define toxic stress, discuss a little bit what some of the research that's come out about it, what kind of impact it has had, and then in the remaining time, discuss some of the conditions and some of the health factors that can be kind of exacerbated by toxic stress and the negative impact that it can have on not only ourselves, but our patients and our community as well. So it's important to understand that stress in general can be a good thing when it occurs in isolation. It is the mind and body's response to elements and events that surround us, and at its core, stress is an adaptive response. So I'll get into that just here in a minute. We've all familiarized ourselves, I'm sure, with the expression fight or flight, or for those of us who know a little bit more psychology, there's some other things affiliated with that as well beyond fight or flight. But it's a stress-induced reaction by our body that either prepares us to make egress from something or engage with something when we find ourselves startled or threatened. So with at least a modicum of stress, we may find ourselves vulnerable to any number of concerns, but the response is what prepares our body to act in these situations. But it's important to note that just as with everything, moderation is the key, and stress is no different from that. When you repeatedly cycle your sympathetic and parasympathetic nervous systems, which is what you're doing when you have a stress response, it can inadvertently have a heavier tax on the body than you may have anticipated. So just like when you're driving a car, you want to depress the gas pedal and the brake pedal with moderation and not just floor the accelerator all the time, because that's not how routine driving should work. And that can obviously cause a number of problems for your automobile. And in that same vein, leaving the pedal to your stress system floored all the time can cause problems for your body. So what stress is that toxic stress is the repeated or chronic exposure to that stress response without your body's ability to return to homeostasis. It can occur in all individuals, and it can be exacerbated by any number of health factors that can be present around us. Without having a steady grounding opportunity or grounding environment, individuals are at increased risk for developing and propagating chronic health concerns. There have been a number of studies that have looked at individuals who have a proclivity for numerous physical health concerns and psychological health concerns in the presence of toxic stress. That can begin as early as childhood, but it can really occur at any point during the lifespan. So again, that positive stress response can be a good, normal, healthy response to something. When you sort of approach not great, but tolerable health response, is when you have more frequent, serious exacerbations of stress, but you are buffered by opportunities to sort of reestablish yourself and ground yourself in baseline. It becomes toxic when the response is prolonged, perpetually activated, and when you find yourself in the absence of the ability to reground yourself, restabilize, or when you're in an environment that is absent of appropriate levels of support. So what are some of the factors that can exacerbate this? I want to talk a little bit about a study, the ACEs study, the Adverse Childhood Experiences Survey that came out from the CDC. What they looked at was levels of toxic stress in children and pediatrics and how it was sort of exacerbated by factors in the environment and other variables in the community that can cause toxic stress in children. And these can be extrapolated to the adult population as well. And I want to read down some of these risk factors And then after that, I want to talk a little bit more about the stress response and some of the adverse health outcomes. And that should probably eat up the majority of my time. So I'll try not to be so long-winded. Basically, what was determined for the childhood population was that the more adverse experiences that were experienced by an individual, the more likely they are to suffer from the outcomes of toxic stress. Several individual and family risk factors that were present in this population that were found to be related to significant stress health responses include when caregivers have challenges related to children with special needs, such as disabilities or mental health issues or chronic physical illnesses. Children or youth who don't feel close to their parents and feel like they can't communicate openly and honestly with them. Children who start engaging in higher risk behavior, including higher risk sexual behavior at an early age. Children who are more isolated or have limited friends group or who engage in even delinquent behavior. Caregivers who have a limited understanding of their children's needs or the appropriate developmental milestones or developmental needs that need to be met. Caregivers who were abused themselves when they were children, because the children then become at risk for being victims of the caregiver's own trauma. Single parent households, low income, lower levels of education and parenthood, high levels of parenting stress, high levels of economic stress in the home, corporal punishment, inconsistent levels of discipline, or changing households with multiple individuals who provide various levels of discipline, high conflict or negative styles of communication, and an attitude of just accepting or justifying violence or aggression, even if it's secondhand. So it doesn't need to be a household where there's violence that's visited upon the child. It could be a household where we just see that violence in general is accepted or celebrated when it's seen or observed or heard about. When you think about the level of impact that can have on individuals who are in homes with those level of structure, but also talk about how the reciprocal patterns that can be perpetuated when children grow up with those factors, then become parents themselves and are working through their own trauma. Those are risk factors that the research has identified to be contributing to exacerbations of toxic stress. As far as the community perspective is concerned, if the individual is growing up in a community that has a high rate of violence or crime, or if there's a higher rate of poverty or limited access to educational resource or economic opportunities, areas where there's high unemployment rate, communities with easier access to drug and alcohol, communities where neighbors don't know or don't look out for each other, and there's a low sense of socialization in the direct community, where there's fewer opportunities for engagement for children and community members to get involved, where there's potentially unstable housing or family members are forced to relocate frequently because of economic circumstances, food insecurity, and high level of social and environmental disorder. And I'm sure there are several opportunities across this state where we can look at certain communities and pinpoint several of these factors and how individuals could be at risk due to them. So the CDC didn't just leave us with all doom and gloom. They did give us some protective factors as well. Some things are sort of up to the community level, but some things are up to us as caregivers and providers. So when families have access to economic or financial assistance, when families have access to medical care, in addition to mental health services. So it can't just be medical care, but mental health services have to be part of that as well. When they have access to safe and stable housing or appropriate education, when they have access to safe childcare, preschool, programs and activities, family-friendly policies, community outreach activities, and partnership between community businesses, outreach from healthcare, government outreach, and other sectors, private sectors who become involved and take ownership of their community. It helps the residents feel connected and become involved. It helps taper the amount of community violence, increase exposure, and feel support. And those variables are linked to the reduction of toxic stress. So I talked about earlier about the stress response. So I'd like to get a little technical on sort of what that stress response look like and why it can be so problematic from a biophysical standpoint. So a normal stress response is when the hypothalamus in the brain senses that there are environmental factors that would give rise to a stress exacerbation, and it produces corticotrophin releasing hormone, which in turn stimulates the pituitary gland to secrete adenocorticotrophin hormone that then stimulates the adrenal glands to release glucocorticoids and catecholamines into the blood. So catecholamines largely facilitate our sympathetic nervous response. So that sympathetic response is pupil dilation, salivary inhibition, bronchial relaxation, heart rate acceleration, inhibition of peristalsis, inhibition of digestive secretion, stimulation of glucose production, secreting adrenaline and noradrenaline, and inhibiting bladder control. These glucocorticoids, in excessive amounts when they're released, they are integral to the immune response in the way that catecholamines are integral to the sympathetic response. And the way that they're integral to the immune response is that they help regulate bone health, bone formation, and immuno standards. So when they're seen in excess, in repeated elevated levels of stress responses, glucocorticoids can inhibit bone formation, can suppress calcium absorption, and those factors can contribute to osteoporosis. They can delay wound healing, they can cause muscle fatigue and weakness, and even increase the risk of infection and the development of autoimmune diseases. Glucocorticoids also act on the hippocampus, the amygdala, and the frontal lobes of the brain, which can cause emotional dysregulation, memory weaknesses, and prolonged exposure can even cause neurostructural changes and start to cause hippocampal destruction. Overexposure to them can also facilitate hypervigilance, in which memory can be impacted because we only at that point in time learn to encode memories when we are in peak vigilance and emotional arousal state, which is one of the variables that can facilitate an increased emotional response for PTSD level flashbacks and other types of emotional memories. So the parasympathetic nervous system is supposed to kick in to relax our pupils, help us salivate again, reduce the amount of glucose that's being emitted in the bloodstream, stimulate bile release, and return all the things back to homeostasis. But when we're perpetually stressed, perpetually in a heightened sense of stress, we overactivate our sympathetic response and we don't engage our parasympathetic response. And this prolonged allostasis is what establishes a chronic stress response. And this is maladaptive. It becomes problematic in children when they sense that the environment that they're in is perpetually stressful. The same thing happens to adults when we begin to associate our work environment or our home environment or our social environment with being on edge or stressful. And then we put ourselves into a sympathetic nervous system response whenever we're in those environments. In the realm of the forensic world, where we talk about the impact of toxic stress on burnout, the expression that I see used most of the time is go to work, get stressed, come home, get depressed. And that's the cycle we want to avoid being in, but we can inevitably fall into when we're in stress. The Yerkes-Dodson curve, which is a parabolic curve, does stipulate that there is a peak amount of stress response that is good, but that's when we're appropriately cycling through the sympathetic and the parasympathetic nervous system and not remaining in prolonged activation. When we do remain in prolonged activation, we trickle onto the downslope of that curve and our arousal and our performance levels decrease significantly. So some of the significant consequences, if you were listening when I was describing the impact that glucocorticoids and those other enzymes have on the body, can cause when you overstimulate the respiratory system, the cardiovascular system, the immune system. The health consequences of toxic stress include, and this is not an exhaustive list, but these are the most common: COPD, depression, early initiation of smoking. It can cause fetal death for pregnant females, low health-related quality of life, illicit substance use, ischemic heart disease, liver disease, risk of IPV, risk of sexual violence, STDs, smoking, even homicidality and suicidality, poor sleep, physical pain, such as chronic pain, migraine, headaches, etc., emotional dysregulation, memory difficulty, anxiety, social withdrawal and isolation. In fact, we've looked at brain scans that have shown children who are exposed to toxic stress levels from a very young age, specifically in this study, ones who are living in poverty. And we showed that by the age of 2 years, they had statistically significantly reduced neural connectivity compared to individuals who are not living in poverty and have lower stress environment. Some of the systems that are chronically impacted, if we look at the neurologic system, it can facilitate difficulty concentrating, increased anxiety and depression, irritability, mood disruption, brain fog, those reduced neurostructural connectivity issues, lower self-esteem, lower quality of life. From a cardiovascular standpoint, high cholesterol, high blood pressure, increased risk of heart attack, increased risk of stroke, tons of stress on the cardiovascular system because of the chronic peaking and spiking and dysregulation of blood pressure. From the immune perspective, like we said, decreased immune function and decreased immune response, lowered immune defenses, increased risk of autoimmune diseases, increased risk of becoming ill, protracted recovery times if you are unfortunately becoming ill, and also, like I said, risk of those autoimmune conditions or exacerbation of pre-existing autoimmune conditions. If you look at it from the diathesis stress perspective, heightened levels of stress can also facilitate the propagation of pre-existing genetic proclivity for autoimmune concerns. Even from the integumentary perspective, we can see hair loss or dull or brittle quality of body hair, brittle nails, dry skin, acne, and delayed tissue repair and wound healing. From a digestive health perspective, slow or weaker nutrient absorption, diarrhea or constipation, indigestion, bloating, pain or discomfort, acid exposures, ulcers, etc. In the reproductive milieu, we can see decreased hormone production, decreased libido, and even in those who are biologically female, increase in PMS symptoms. From the skeletal and connective tissue region, we've talked about increased concern for inflammation, so exacerbation of carpal tunnel syndrome or other connective tissue concerns, tension, aches and pains in the joints, muscle tightness, etc. So the impact of these kind of these multiple concerns here puts such a stress on the system. One of the comments that we received said, sounds like COVID. It does have sort of a comprehensive system response in the sense that it will impact every part of your body. There's not one particular part of your body that is targeted more than the other, but it will do is bring about weaknesses or concerns that may be pre-existing and then draw upon those to cause long-term concerns and difficulty. So if you have pre-existing health conditions like asthma, or if you're exposed to concerns that could exacerbate lung or breathing or shortness of breath concerns, or if you have multiple sclerosis, lupus, Lyme disease, or hypertension, hyperlipidemia, if these are not attributable solely to the impact of toxic stress, they can certainly be exacerbated by the presence of toxic stress. So we need to look at individual and personal factors, community factors, and as providers, making sure we're giving out appropriate education and information on managing these concerns, because the best thing we can do once we have these issues is start to manage them from a symptoms and a systems perspective. I want to see if Dr. Miller or Ali is available to just check in and see where we're at, because I don't want to take much more of anyone else's time if this is a good transition point.